Hello, I'm Dr. Sanjeev Jain. I'm a joint replacement surgeon in Dr. LH Hiranandani Hospital, Powai, Mumbai. Total hip and total knee replacement is a very old procedure. It's about 40 years plus old. And there has been a complete transition or paradigm shift now from implant to the technique to the surgeon experience and also the patient profile. So there's a lot has been changed in the last 40 years. Like you have a better quality of implant where you can have a better function. One, you can have a better material or the articular surface in the joint surface area where the joint can last for a very, very long time. You have a newer technology where you can take the assistance of technology into the surgery and which can also add to the function and also the longevity of the joint. And there are a lot of painless surgery which is happening now for many years, where patient is coming more and more in terms of numbers for the surgery because they're getting better confidence, there's no pain, and they're getting a better results because of everything which is combinedly done. There's a huge difference because earlier there was non-availability of all kind of different implants, different multinational companies having availability of their presence in the country, especially in India, and naturally the awareness amongst the patient was also not that high. Now everything is changed because of the great results which many surgeons and hospitals are producing for many years. Patient fear factor which was there especially for the pain is gone, and people are seeing that patients are getting an excellent result and their quality of life is improving after the surgery. So I'm sure with so many things combined together again has increased the volume of the number of the patients to come for the surgery because their longevity is also high, so they cannot suffer with the pain, so they're coming for the surgery in more and more number now. We are a center where we definitely focus on a care of the patient, one, the quality of the healthcare delivery which we do it, two, and definitely we are working as a team. Now these surgeries are not just only doing a surgery by a surgeon. There's a team of physiotherapists involved, team of nurses involved, team of anesthetists, doctor involved to take care of the patient, and also even the dietitians are involved. So there's a combined efforts to keep a holistic, complete patient's care or well-being where the patient gets a complete satisfaction and excellent result. So I think the teamwork which makes you a better center and a quality center. Decision-making process depends upon the type of pathology patient has it. Like in hip replacement, again the patient has got a fractured neck femur or the hip ball fracture, or he's got some kind of problem in the hip ball due to any other pathology like a avascular necrosis of the hip or any other kind of arthritis like a rheumatoid or ankylosing spondylitis. Or in the knee, it depends upon what is the stage of arthritis, whether this arthritis in an early stage or involving the one part of the joint or one compartment, or it is involving the whole joint. Suppose it's one part of the joint is involved in a younger patient, then naturally the whole knee need not be changed. It's called a unicondylar or half knee replacement, which has got an excellent result for a long term for 10 to 15 years, which can be provided to that patient. The decision is changed here. The patient who's thinking of knee replacement could go back happily with a half a knee replacement. The patient who has got a completely bad knee, very advanced stage of arthritis, he is a candidate for a total knee replacement. Now, any patient who is a 70 years of age for the hip fracture, he would undergo something called a bipolar hip replacement surgery where he can be mobile immediately. But any patient who's got a avascular necrosis of the hip, he's young, 40 years of age, he would require a joint which is going to last for at least 20 to 25 years. In that case, probably we are using something called a ceramic and ceramic uncemented joint. So there are varieties of things, the patient's bone quality, patient pathology, the type of the bone we are having it. Depending on all those factors, the choices of procedures and also the choice of implant varies. The robotic surgery is a new thing in the joint replacement surgery. It is still evolving basically. The computer-assisted surgery which we are doing in this hospital for last 14 years plus. Now computer-assisted surgery is at its peak. Basically, with the computer-assisted surgery, you can give excellent precision, excellent accuracy to the procedure, and you can also think about a longevity of the procedure. Now, only difference between the computer navigation and robotic is there. Robotic is definitely a more precise method of doing it, but here robot is not that 100% come to that every technique or every part of the surgery is done by the robot correctly. And one, two, robotics are hugely costly affair at present time in the country. So naturally, every patient and every hospital cannot afford it, the 8 CR or 10 CR of robot in the operation theatre for a surgery which can be done in a lower cost. So there's a huge difference between these two. So the challenges today in joint replacement surgery is basically one of the the major thing is the cost. Now these material which are put inside the joint of the hip or the knee, they are costly material which cost, especially in the knee side, around 80 to 90,000 rupees, and hip side it could be more depending upon whether you're using a ceramic material or non-ceramic material. It could be more than 1.5 to 2 lakh rupees as well. Now one thing is this. Second thing is these surgeries can be done in a smaller hospital or big hospital, but always a big hospital and institution, the cost is definitely more because the huge setup is there, and then naturally hospitals spend a lot of money there. The quality of care is actually not cheap in the world. Anything which is a quality is naturally has to have some cost available in anywhere in any profession. So the people are trying to understand or underestimate the cost, because there's huge cost is involved to get an excellent result. Though we are not a very hugely costly hospital, but naturally it should be affordable. That is one important thing. The second important thing is there's a huge lack of awareness of the insurance process in this country, and there are different kinds of insurance which is available today, and different insurance company governs the cost, which they are not aware of what is required, what is the quality care is required. Somebody wants a 25 years, 27 years experienced surgeon like me doing a knee replacement at the same cost, and somebody is doing a 1 year experience the same cost. It is just not possible. You want a Shah Rukh Khan to do a movie on a cost which even the just coming up hero does it, it is just not possible. So naturally people have to understand that the quality care has a cost, and which we have to understand as a country. The policy maker has to bring this out very clearly. Not somebody has to just go ahead and say that you should do a knee replacement surgery on this cost only. Now, if I ask the policymaker to do this, then probably they don't consider the cost of their whole structure there. They only consider cost of the operation and the material. Here in a private setup on a corporate hospital, everything costs to them, and then that add to the cost brings a little more cost. So you can't have a knee replacement surgery in a lakh rupees or 1.2 lakh rupees cost at all with a standard good quality implant. So our future plan is to bring a patient to a real expectation, what their expectation. Our quality care, our results should match that. So what we are trying to do it now, and basically we are one of the first hospital in the country. We are looking for doing an outpatient joint replacement surgery, which we have already started. The patient who is a very selected group of patients, yes, very well informed patient, and definitely those patients comes in the morning, very well investigated, getting the surgery, knee replacement or hip replacement surgery done, and definitely they are getting out of the hospital in the same day. Why? Because they have been motivated. They do not require a stay. The technology or technique which we are going to use going to give them a so fast recovery, and our anesthetists, they give such a painless surgery or painless recovery, so they can go definitely the same day after the surgery, which is called an outpatient joint replacement. We are doing some techniques in the knee replacement where we don't cut the muscle, which is called a subvascular approach. Patient can start walking immediately. Now in the hip, which we have started doing a direct anterior approach to the hip, where even the muscles are not cut, so patients walking the same day without any support. So what we want to do them a very quick, fast, early recovery, going back home, and definitely that is going to be the game changer in the joint replacement surgery.